Hello, can we come in? they'll count you down.
Good morning, everybody. It's Chantal Kutse from Investec Bank, and welcome to today's session. We will be talking about formulating a recovery strategy during this COVID period. So during COVID, the purpose of our discussion for today is to determining the operating methods during lockdown, the impact of the government policies on the organisation, the impact of the newly adopted behaviours, social behaviours and workplace practices in the organisation, the impacts on service delivery to our clients, and determining the return to work modelling. So what did Investec do from the beginning when the pandemic started? We started monitoring the pandemic since the end of February. We first invoked a smaller incident management team of about 10 people just to determine the extent of the threat and quickly realized that if we don't act very soon, this could have serious ramifications. We then invoked the full crisis management team on the 4th of March. Due to already having crisis management plans in place, our crisis communication and business continuity plans in place, these were used as the base for the response, as our plans are generic enough, sufficiently generic enough to be applied to any type of a scenario. What we mean with that is that roles and responsibilities are clearly defined. The actions and communication channels are clearly defined, as well as the process for response. So everybody knew what to do when. One of the first actions were to ensure that our people are safe and that we can enable them to work from home in the shortest period of time. So although we have in our business continuity plans already as a strategy to work from home, we now were looking at large numbers of staff to work from home. The following are how we address the different aspects to enable this operational resilience method. So from our operational response, what we did was the welfare in our staff and safety of our staff remains absolutely paramount. We moved more than 92% of our people to work from home within 2 weeks. We ensured that our critical key areas, so those people that could not work from home for various reasons, were actually split into 3 different areas and separate teams. We implemented the protocols as governed by the regulations around the sanitization and the cleaning of the regular cleaning of the buildings. We upgraded our infrastructure because, of course, we now have more traffic from a technical perspective, so we increased our bandwidth and our licensing of a remote security software. We heightened then, of course, the awareness of the cybersecurity team. So from a people's perspective, what we then did was we continued irrespective of what the alert level of government was. We continued with our conservative approach by requesting our people to mostly work from home, and as we were continuing to monitor the infection rates. The key safety protocols across all the locations with a detailed track and containment process were implemented. That was the key, is in terms of the track and containment process. Staff required in the office were split, of course, across the buildings and even across the floors. Then extensive well-being, because people get tired sitting at home, working from home. They're used to a certain routine, and now the routine has been turned upside down. Extensive well-being of offerings were provided to our staff to support staff from a physical, a mental, emotional, social and financial well-being. How did we enable our staff? We upgraded our remote security software licenses to support concurrent users. The issuing of fully imaged and managed desktops, new desktops and laptops to create that working from home environment for critical staff. We issued mobile data services and contracts for the South African staff, Wi-Fi routers and data dongles to allow remote connectivity. We assisted also critical staff working from home to deal with load shedding, because just as much as the COVID is reality, load shedding in our country is also. So we had to make alternative arrangements for those absolute critical staff, and here we think about traders that were working from home, to enable them to even work during a load shedding. We also enabled WebEx as a tool for external communications and Teams for internal communications. So from a network capacity, we obviously have now more traffic on the network. We had to upgrade and continue to improve our network capabilities as we started to understand what the length of this work from home scenario would entail. So we upgraded our firewall and our core network capacity to allow for this increased remote network traffic. Remote security software and internet bandwidth was then also upgraded. From a cybersecurity perspective, obviously this was a high risk noted for everyone that was working from home. There have been no significant increases or decreases in cases handled by our cybersecurity incident response team since the start of the COVID pandemic. None of our security controls were changed, bypassed, amended, or anything of that nature as a result of the working from home. The remote security software still validates the entry of all onto the Investec network, and therefore personal computers cannot be connected to the network. Collaboration with other cyber forums served as formal and informal threat intelligence and sharing initiatives. So then that was operationally in terms of what we did to mobilize our people working from home in the shortest period of time. Now it was for the further processes in terms of what was the level of oversight from management and the board during this period. We had, as a crisis management team, we regularly communicated to the leadership teams and staff. That is one key item when it comes to any crisis, is continuous communication to all the stakeholders so that everyone stays informed and understand what the process is that we are busy with. Any key concerns that could not have been addressed by the crisis management team were escalated to the EXCO, Executive Committee, for resolution, and this was then communicated to staff. We on average communicate around what our processes are, what our view is, and so forth, at least once a week since the beginning. We also provide regular board reports with the latest information on impacts and resolutions. So all stakeholders remain in contact, understand what we are busy with, and is informed. So now let's look at what is the impact of government policies on the organization. So right from the beginning, with the alert levels 1 to 5, in a nutshell we can say that the regulations has been a challenge, as I'm sure that most of you have experienced, especially in the financial industry, being a highly regulated environment. In addition to ensuring operational resilience, we had to ensure the compliance to the regulations provided, and this was a challenge. The regulatory obligations of an employer is to provide and maintain a working environment that is safe and without risk to the health of its workers. Develop measures to ensure that the workplace meets the COVID standards and health protocols, adequate space for workers and physical distancing measures for the public and service providers. So you can imagine if you've got 4,500 people in a building, to apply social distancing of 1.5 meters apart from each other. It takes quite a bit of planning to understand who should be on site, who should work from home, and who should be at a third site potentially. And also the obligations of the employee is to take steps to eliminate or to mitigate the transmission of COVID-19 in respect of its workers and any person that is directly affected by the organization's activity. So people coming onto site, and that will be your vendors, your visitors, and your clients. So those three key things that came out from the regulations was the base for us to write up our workplace plan as required by the regulations. The occupational health and safety site risk assessments were conducted. We did this per office, and the risk management plan was completed. We performed a compliant self-assessment against the relevant regulatory requirements and found to be adequate in all requirements needed. We revised our occupational health and safety plan, our policy, due to and included the COVID requirements with specific reference to COVID requirements. COVID-19 protocols were developed and approved and rolled out, and the containment process for infections were designed, and it was rolled out. These did take a number of weeks to complete it, as you would know and have experienced as well. But it was, we have concluded on that in about 3 weeks' time. We erected perspex screen guards in receptions and in the and temperature checkpoints. We intensified the cleaning routines, specifically common touch points such as lifts, escalators, the escalator bands, lift buttons, door handles, and bathrooms. So we put a process in place to have these cleaned every second hour at least. The buildings are then fogged every 14 days, and once there is for our critical staff, so specifically from our call center agents, we then navigate between the two buildings of which teams sit where, because during this fogging process no one can be on site. We put up the reminder notices around all of our buildings in terms of temperature checks, the wearing of the masks, and how many people are allowed in a lift, social distancing requirements, and the COVID-19 symptoms. We developed a visitor questionnaire, designed that, and we rolled that out in the event that visitors come on site. 2 masks were provided to each staff member for those who obviously came then on site, and we appointed a COVID compliance officer. We also developed then the compliance monitoring checklist, and escalation process was implemented, and we continue to monitor as such. So what was the challenges that we experienced? So we experienced, specifically in the earlier days, with the curfews that was put in place, especially for our staff that was working 24/7, that is required to work 24/7, because that is our service that we provide to our clients. We had to issue the permits and register the company as an essential service, being in the banking sector. But typically what has happened was that staff were stopped at 3 o'clock in the morning and interrogated for reasons why they are on the road during these curfew times. And those things has posed challenges, because you've got the regulatory requirement, but you also have to do with a human being of which you are requiring them to work on site. until their shift is over. The onerous processes, so the containment process is quite onerous in terms of its track and trace. We have refined that process so that it is practical in our environment. And we report these infection rates to the Department of Labour and Health as required. These days, well, in the last month, it was you have to report to the NIOH based on a specific criteria that is required. There was also a little bit, we also seek clarity on some regulatory obligations. Because the interpretation of these regulations differ from organisation to organisation and literally from person to person. So we seek continuous legal advice in terms of what is the requirement from the organisation. We were also fortunate in terms of our of the Banking Association of South Africa, where we meet at least on a weekly basis, and we can bounce off ideas against one another, and also get to a common understanding of what the regulations are requiring from the organizations. And that is very helpful to collaborate with the communities that is in the same space as what one is. Then, of course, I think the major impact was the unexpected expenses. This unexpected significant expenses. So we all budget once a year, and we obviously did not budget for all of the regulations to be implemented at the same time. But it's a balancing act, so saving on the one side, but also expending on the other side. So the expenses were quite significant in terms of the operationalization of the regulations, as well as mobilizing the workforce. As mentioned in the earlier slide, in terms of upgrading the network, providing additional laptops, providing data cards to staff, to operationalize and to mobilize staff to work from home. So then, what was the impact, or is the impact, of these newly adopted social behaviors and workplace practices? The challenges experienced in the workplace for the social behaviors, so in essence, it's really about wearing the mask, sanitizing, social distancing, and your temperature checks. That was very key previously for level 1, alert level 1. We found that the wearing of people are creatures of habit. So to change that behavioral activity of people to now expect them to wear a mask continuously. I heard yesterday in terms of change management, it takes a lot of change management, encouragement, and continuous reminders for people to wear their mask when they are in public spaces, within the building as well as when they go outside. Each staff member in our, with Investec was issued with 2 masks, and obviously, like in any other retail or any other bank or any other organization, no mask, no entry rule, and then that would be applicable to clients and to visitors. So it is just this continuing enhancement and reminder of why you wear a mask, when you wear a mask, and what's the reason for that. The other challenge experience is, of course, the sanitization stations. So again, people are creatures of habit. So the reminder around sanitize every time, so placing sanitizing stations on strategic places across the building is imperative, so that it is in people's face, so that when they walk past it, that they've got no other option but to sanitize. Then we talked a bit about the social distancing. So seating people 1.5 meters away from each other in already a quite condensed area does prove a challenge. However, it is work that goes with the planning of what teams should be on site, how many people per team, and which teams are critical and which not. for that specific reason. And those are quite easily executed, or was quite easily executed, because it was already identified in the existing business continuity plans. And then, of course, the temperature checks. So all staff and all visitors that entering the building, conducting the temperature checks, monitoring, reporting to the, well, today it's the NIOH, National Institute of Health. So what was the further impacts of these social behaviours? Again, the unexpected expenditure. I don't think in the beginning of this year or at the end of last year we expected to buy so many masks that is required if you have to provide 2 to each staff member. So significant expenditures. Signage was placed all over the common areas and at the lifts in terms of how many people can be in the lift. So the impact there is really reminding people that you cannot now get 10 people into a lift. You can only now be 2 to minimize that risk or minimize the risk of cross-contamination. The culture impact is significant, especially in our environment, where our culture is very much of a collaborative and consultative nature. So the teams and our staff members had to find new ways to still continue with the collaboration, and hence why we implemented WebEx and Teams to assist with this process. And I must say, as time has gone by, everybody now knows where the mute button are, everybody now knows where the hand raising button are, and now getting actually quite creative in terms of the backgrounds that when we have meetings. We even arrange some social events where over Teams, where we each would sit on a Friday afternoon, have a cup of coffee or have a drink and still collaborate with one another. So these are new means of still keeping the culture alive. Obviously, productivity increases. This is another positive. This is another positive impact that it had. The work from home, we always said once we were on this N1 coming to our work, we always said we spend 2 hours, we spend 2.5 hours in traffic. That 2.5 hours is now added to the day, either in the morning or in the evening or during the day. The flexibility for working, that came with the working from home strategy has helped significantly. Obviously, the social interactions is the canteen, so we had no canteen that was open in the building, and also no social gatherings was necessary. Social gatherings was allowed. But again, working from home and still enhancing that collaboration through Teams meetings on a Friday afternoon, get together with a coffee over Teams or a drink. So what was the impact on the service delivery? So the planning, the strategy for any crisis management plan or for any business continuity plan is really to minimize that impact on your service delivery to the client. So in our environment, because we are essential services, there has been very little impact to the client directly. Being the financial institution, we provided debt relief packages to our clients for those who needed it. We had our 24/7 call center availability. The bankers were still able to communicate to their clients via a virtual platform. However, our clients are used to the human touch and the personalized service, and this did, of course, posed a challenge. So yes, we can interact through Teams, we can interact through a WebEx or a Zoom, but it is always, you want to talk to someone, especially when we talk about banking affairs. It was a bit challenging, however, clients has also adapted to the new way. Our logistics business was actually the hardest affected through this due to the border closures and the delay in international deliveries, especially then from China. It is only now that the borders have opened that we are starting to see recovery from that point of view. What are our plans and our priorities for going forward? So what does the world look like for us going forward. The well-being and the safety of our people remains our primary responsibility. We expect the return to the office to be gradually. I don't think anyone is in a haste to get back. But on the other hand, we have had people they want to come back. They are tired of being home. The children are driving, they're crazy. The wife is screaming in their ears, and they want that quiet time. They want to come back to the office. They want to speak to their colleagues. They want to interact. That's basic human nature. However, we do see the slow return only happening over a couple of months. And it takes planning to do so. We remain committed to support our clients and provide industry-related services with no disruption, as we have had up to now. And then from a productivity point of view, we continue to monitor the productivity and the key risk indicators across all our business areas. But our business model remains, and I think it will remain for quite some time, where our first priority is, if you can, work from home. Critical functions to be split across floors, locations, and so forth, and then set the maximum allowed staff numbers as required or deemed safe to do so in the environment. So, for instance, in our head office, we remain at 30%, irrespective of what the regulations are saying. We don't want more than 30% of our total complement within the offices. Our branches being smaller, not having as much as traffic as what our head office have, we have escalated that to a 50%. The approach do consider each phase of the government risk-adjusted alert framework, and we adapt our programs and our plans as it is required. We do a month-to-month review of the current approaches regarding our offices, events, people going out, meeting clients physically, having the face-to-face interaction. Guys, the new norm has arrived, and we are learning as we are going along to live alongside the virus. It's not something that will be gone tomorrow. It will be with us for some time until a safe vaccine has been implemented. I thank you.
Thank you very much. Thank you, Chantal.
Pleasure.
Under normal circumstances, would be taking questions right now. But what we've decided to do, which might work much better, is allow all the speakers, all four of them, and then after our fourth presentation for the day, we will have a Q&A/open discussion, but we'll have that via Zoom. So I think that will work a lot better, because it means you also don't have to stick around. You can go back to your office and join us at a later stage. But what I'm suggesting to the delegates that are joining us this morning is to just make sure that you make a note of all the questions that come to mind as the speaker is standing here, so that we can, during the open discussion, it can be a fruitful open discussion. So we'll just continue. My next speaker is on cue. She's ready to rock and roll. And we'll continue with the third speaker and the fourth speaker. Like I said, after the fourth speaker, which is, so today we only have 4 speakers, we will then have that Q&A from literally the first presentation to the fourth one, and then have an open discussion. And that's how we're going to close our day. I think that will work much better than interrupting with Q&A sessions in between. Once again, thank you very much, Chantal. And we're going to move on to our next speaker for the day. And she is ready to rock and roll. There we go. That virus. Just looking at it, it sends shivers down my spine, doesn't it? All right. So, like I said, our next speaker is ready to to rock and roll, and I'm going to introduce her. Her name is Indrani O'Reilly Govender, O'Leary Govender, who has a master's in statistics. How do you get a master's in statistics?
Study very hard.
Studying, right? That's the only way, right? And Indrani is a senior lecturer at the moment within the Department of Finance and Investment Management in the College of Business and Economics at UJ. Prior to joining UJ, Indrani also taught at the University of Cape Town, University of Western Cape, and at City University in City University's Cass Business School in London. She has experience outside of teaching. So her experience comes not only from teaching, but she also worked as an equity analyst at Allen Gray. I mean, she has a wealth of experience. If I went through her biography, would probably be standing here for the greater part of the morning. The one part that I want to stress is that, as she's presenting, she's combining experience that comes from the academic side as a lecturer and also from the practical side, because she has worked in the very same space. So I'm not going to take much of your time. I'm going to allow her to join us on the podium and then take it away, Indrani. The floor is yours.
It is still morning. Good morning. I am going to try and help you understand a little bit about artificial intelligence, something I'm still learning about. But before I start, I just want to, most people when they hear about artificial intelligence and the fourth industrial revolution and big data, it's quite confusing. But I'm going to try and talk about two things before I start my actual presentation, which I hope will give you a little context about how useful this is. When you think about AI and big data, you think computer science, you think computers, you think stuff I'm not going to know about. I'm going to start with something which is not such a nice topic, human trafficking. During this time of lockdown, they've actually, surprisingly enough, it has not benefited human traffickers because they can't actually get through the borders. But there is an organization, and several of them, who are actually using the information from big data, using artificial intelligence, and in so doing, analyzing the data and giving bankers and humanitarian organizations information that they could use to track and understand how this is done. On a lighter note, for those of us who drive cars now, and compared to those that we drove years ago you put your key in, you started your car and you went. Now you have a computer. And so essentially what you have is a car that thinks and learns. There was a vehicle whose battery was dead, and essentially its owner had to reteach it how to do things. So your car really can't do without you. And if you wanted to get amnesia, just turn the battery off. So we're going to look at artificial intelligence and the coronavirus, this very interesting virus that has us doing this, speaking to each other long distance. What has it done? How does it help us? In some ways, the coronavirus has created opportunities to look at how the world can work differently. We're used to doing things a certain way. We need social interaction. We need to, or we thought that we needed to be with each other in order to get things done. When we look at how life has changed, how much we have been forced to stay apart, and how artificial intelligence and automation and distance learning, distance working has become the norm. As people say, we don't work from home, we live at work now. So when we look at automation and artificial intelligence, automation is essentially technology with minimal human intervention. So your vacuum cleaner, your machine. Artificial intelligence, on the other hand, is developing and working with machines so that they can learn and understand, and in a sense, get closer to the way we look at things, get closer to the way we understand the world. So they use it for visual perception, speech recognition. decision making and translation of languages as well. Now, when we look at artificial intelligence, we have machine learning and we have what they call deep learning. Now, in classical machine learning, we basically give the computer a program and it follows. So that is supervised. We have a set of rules that the program follows, and it has to follow those rules to get to the answer. There is something called unsupervised machine learning, and that's all about letting the machine find out what's there. So when we look at this example where it's actually stacking up clothes, it's creating outfits as opposed to stacking all the socks and the shirts and everything together. So we're giving it an opportunity to do something different. We're not controlling the outcome of this. When we look at deep learning, that's where we're trying to get the machine to think like us. So we're giving it information and we're trying to get it to understand what that information is. So basically we will give it information on which we will train it. So there will be outcomes from that. It will learn from that, and then we will give it information on which we will test it. So ultimately with deep learning, you're trying to get the machine to look for patterns, to use information that we've given it, but to learn from that. So that as it goes forward, it finds things that we don't know, that we're hoping to learn. When I talked about the human trafficking instance, they actually use the information from bank accounts to try and create patterns that cash flows will take in order that you can then use that information to track and trace. So when we look at artificial intelligence and automation, what is the difference? Well, with artificial intelligence, we're looking at something that's going to learn, something that's going to adapt. So when you drive your car, if you drive one of those cars with a computer in it, it actually learns about how you drive. So what your driving patterns are, what you do with the car. Okay? With automation, it's trying to take a process and basically make it easier or take out the human intervention in that process, or make it as little as humanly possible. When you put your clothes in the washing machine, you press the button, the machine washes your clothes. Yeah, I even have one of those little vacuum cleaners, which vacuums my floors and mops my floors without me. That's pretty cool. So it makes sure that with automation, you don't have to get involved in the process that much. You save a lot of time and the work gets done. With AI, you are learning about things that you don't already know about, and you've got a machine that's sifting through all this information. So it increases productivity and it increases revenue. Self-driving cars. Okay, so the coronavirus. All of us here have been affected by it. It's changed our lives. In some instances, it's actually added some value because we now understand the value of human interaction. We understand how much we need one another, and we understand how the world works better when we are together. But it's taken a lot away from us. It's forced us into working in ways that, although more productive, have affected our lives on a daily basis. So we now work from home. We have this virus that we can't see. We have something that is a threat to us, but it's something that we can't control as yet, except for wearing of the mask, washing of the hands, and unfortunately the social distancing. But as I said, it's forced us to think outside the box. I think a lot of employers have considered working from home to be a problem because we're not quite sure if people are actually going to do it. But right now it's become the norm. So what has robotics done? Now robotics is part of the automation process. How does that work now? What has happened that means that we actually have to have this, right? Because this is such a contagious illness, we can't really be near each other. We can't be around one another without having the face mask. And even if we're in the space with each other, we have to stay far away. We have to social distance. So you've got robots that have now taken up the responsibility for things like checking a patient's temperature, delivering foods, disinfecting hospitals in large areas, trying to minimize the human contact that you have that. And if you look at all the various countries that I've listed, they have introduce robots to take away the responsibility of placing human beings in conditions that are going to hurt them. So trying now to introduce something which is very unlikely, impossible for it to actually get sick, so that we don't have to. Okay. But again, remember what this introduces. It introduces a new dimension. So going forward, when we treat patients in hospitals, we can now use robots to do some of the work. It increases the capacity, takes away the load from our current medical staff. But unfortunately, the important bits, where we need the human interaction, that will have to continue. Because if you watch the news as I do, a lot of people are dying alone. We can't actually see them. Okay, so all the menial tasks that previously we had janitors do and orderlies do, you're now having robots do to minimize human interaction. Okay, so if you look at here, we have in hospitals, you have ultraviolet light disinfectant robots going through the hospital to disinfect. You even have a robotic pharmacy where you have robots dispensing medication, robots that clean floors, used for hospital logistics, how to get things around the hospital easily and with as little human intervention as possible. This is an interesting one. They now have robots they use robots to sift through recycled material. That's very interesting, because now we have our own people doing that. And for those of you who want to go to a bar and need to social distance, they have a robotic cocktail mixologist. He'll make you your cocktail, but he won't listen to your stories and give you any sympathy. So how else is it being used? Now we're looking at artificial intelligence, because remember, AI deals with big data, trying to find patterns, trying to use that information so that we can get useful results from it, which we can use. So doctors in China use AI tools to spot symptoms of the coronavirus. They have built in China, Beidou has built a no-contact infrared sensor system to quickly recognize individuals that may have the symptoms. In Israel, Taito Care offers on-demand medical exams. It uses AI to provide clinical-grade data to doctors who work remotely. So now you have doctors who are sitting elsewhere, not with the patient, using information accessed remotely to diagnose, to give advice. In India, they use video bots. They use these on the railways. So they created these video bots to use at railway stations. And now they're using them in healthcare companies. They take questions from people, and the Chennai-based Apollo hospitals have developed a risk assessment scanner. It's available in 6 languages and helps people with the potential risk of having the virus. So it's used for biometric identification systems to track the virus and maintain lockdown efforts in areas affected by the pandemic. In the US, you have Tampa General Hospital has implemented an AI system in conjunction with CARE. So at its entrance, it uses it to discern patients and individuals with potential COVID signs. So using information we've gathered, information individuals can't process, to actually be useful in diagnosing and treating patients. So in terms of artificial intelligence, we're looking in the medical sector. They're using it for early detection, diagnosis, predicting outbreaks. They're using it also for drug and vaccine development. We now know that there's potentially a vaccine from Pfizer that is 90% effective. So they're allowing in organizations to be able to scale and adjust. They have virtual assistants and chatbots. They're helping people to assist with social distancing, and AI-enabled scans help with speeding up detection. Okay. Now, in terms of banking, which is not necessarily medical, but they are predicting future losses, because remember, in terms of what has happened to all of us, it's not just the medical side. People have lost their jobs. Companies have closed down. People cannot pay their mortgages. They cannot pay their loans. So the banks are going to experience increased losses. So they need to be able to predict these future losses and use what they call more agile risk management and liquidity management. Okay. The other thing that has become extremely more apparent since this coronavirus has visited us and the lockdown is how much countries import. Now in South Africa, we import, 100 billion, more than that? If you localize only a fraction of that, we would be able to increase the job, we would be able to boost our economy. So things like localized automation in terms of bringing in manufacturing. Social media has become extremely important. This is how we now connect with one another. People who used to hold concerts live now hold them through social media. Okay. And also in terms of businesses, how they connect with their customers, their automation, analysis of data. So in this era, businesses have had to think differently how they connect with their employees and how they connect with their customers. And they have lots of data to do that. Now, I don't know if any of you have a PlayStation. If you have virtual reality, you have that big headset, okay? There's augmented reality and there's virtual reality. And I think with us all living at home, we need something. We need some sort of reality to take us away from where we live, okay? So augmented reality is an interactive experience where they basically take a real world environment, so whatever environment you live in, and they enhance it using computer generated perceptual information. Sometimes they say it's across multiple sensory modalities, including visual, auditory, haptic, somatosensory, and olfactory. So they try and enhance what's real in this world. So what you're seeing in your own home, they use computer-generated image to enhance your perception of it. Virtual reality, on the other hand, is something that technically doesn't exist. So if you play games, if you play with your PlayStation, you literally put on a headset and you see what we don't see. So you become part of a world that's not real. But amazingly enough, they actually use it not just for playing games, they use it for post-traumatic stress disorder, treating it. So they use it to treat psychological disorders. So somebody who's come back from a war-torn zone, who has been fighting, and who cannot get past what lives inside their head, they actually use virtual reality to treat them. So they take them back into a virtual reality world and try to desensitize them, try to create a situation in which they can distinguish between what's real and what's not. Because for somebody who starts suffering from PTSD, they can't. They're constantly living where they were, and they can't bring themselves back into this world. So they use this. So it's a computer technology to create a simulated environment, not real. So when you take off the headset, the world disappears. There's actually somebody in Africa who developed a game, a virtual reality game, where if you play the game and you buy things in the game, you actually support real people. I don't know if you've all seen that. It's been on CNN. So users are immersed and they're able to interact with a three-dimensional world, which when they're in that virtual reality world is real to them. Okay? So there's vision, hearing, touch, even smell. The computer's transformed into gatekeepers into this artificial world. They say the only limits to near real VR experiences are the availability of content and cheap computing power. So the better the computing power, the better the experience. Okay, so how do you use AR and VR in education and training? Because I'm in education. And so one of the things that has happened in my world is I don't get to see my students anymore. And my students don't really get to see me. I can lecture to them live on what we call Blackboard Collaborate, but we don't get to see each other because our computing power and our data needs and things like that mean that putting out videos for all of us becomes a lot more difficult. But think about how you would train a firefighter. How would you train a technician or a mechanic that works on aircraft? How would you place somebody in a hazardous situation so that they learn how to deal with it but don't get hurt? That's what AR and VR can do. So when we look at the less scary things, so there's compliance training. You can training that takes place in a fully rendered and realistic 3D training environment. The training and assessment activities are specifically designed to challenge workers on their knowledge of health and safety regulations and compliance. On-the-job training. In hands-on training, hands-on method of training the learner, so you create a virtual environment in where everything seems real, where they can do what they need to do. As I talked about, doing something, if you're learning to be a mechanic or you're being trained to be a mechanic on aircraft. I mean, we see it when we look at pilots being trained using simulators. They are taught to fly planes, take off, land, emergency landings, all on a simulator, which creates the impression that they're there but they're not. So they really can't kill anybody, do anything bad. But interestingly enough, if you watch that movie about, do you remember the plane that landed in the Hudson River in America? They did the whole thing on the simulator, but the one thing that came through was that and this is where what we learn, what we know, and what happens in our brains with our experiences actually gives us a slight edge over computers, so that we can think out of the box. And that was what helped them to say they tried the same thing on the simulator, didn't work. So if you want people to learn about critical skills, thinking and training, the immersive nature of virtual reality allows the organization to take the benefit of using VR for training. So you can make the employee feel as though they are where they need to be, so that they are there in real time. Training in hazardous situations, as I said, firefighters, you can simulate the environment that are actually in a fire without being there. Okay. So, employee onboarding, you want to give an employee a virtual reality tour of the organization they'll be working for. Product training. So you're given a visual hands-on experience in front of machines, improved assembly and maintenance, and the learner can immediately put things into practice. Sales training, again, same thing, and soft skills training, okay, can help the learners to take individual parts. So you can create a learning arena in a virtual reality world that allows each and every one of us to learn how we learn without being guided into a specific path. Augmented reality deals with visualization. You get to see what is happening. They have programs, they have virtual reality learning tools that allow medical students to work with a body, learning how to do certain things, identifying diseases without actually seeing the body. So like a hologram. Okay, so that's the visualization. Annotation, where you are, well, annotation is about your addition to what is happening in the story. So you can annotate, you can add your ideas, you can add your views to it. And augmented reality is also about storytelling. Okay, gives people the opportunity to shape a story, to create a story. Okay, the other really important thing and interesting thing about augmented realities is retail. We have for a long time shopped online. Okay, we go on to Amazon, we go on to Kalahari, we go on to Takealot, and we find things for a lot less. But now they're taking the whole idea of retail, online shopping a step further, creating environments in which you can actually step into a virtual closet. You can create outfits. They even have customers testing makeup so that they can use them and they can use the information they get from them to improve the products. As I said, consumers can actually go into the shop virtually and try on the clothes and create outfits for themselves. So you created an environment where, in this current situation, where people can do their shopping and feel like they're part of the shopping experience without leaving their homes, but still feel like they are shopping in a way that they would normally do. They'd go into the fitting room, they'd try something on, they'd get a few things. So they're trying to create, in this augmented reality, an idea that you try before you buy in a safe space. Okay. So, as I said, we've had robots. They have something called a cobot, and there's a company in South Africa that actually manufactures these. These are the robots that work alongside humans. So they work alongside people to help them with tasks that can be automated, that the person could easily let a robot do while they get on with other more important things. And it helps in this current environment for social distancing, so we don't have to have a lot of people around each other. These cobots can also be redeployed quite easily to different functions. And that is important because at this point we need flexibility. So the thing about a cobot is, rather than automating the entire process, rather than having a robot or this cobot do everything from start to finish, they can do the bits that they're good at, and the person can do the bits that they're good at. It's kind of what we do with people, but as I said, we're taking one person away from the equation and putting them into a safer space with social distancing. Now, what is the world going to look like post-COVID? Where are we going to with artificial intelligence and automation? What's going to happen? Well, let's look at the world around us. We were already moving towards AI. We have the self-driving cars. Look at your phone. What does your phone do? It knows pretty much everything about you. You can bank on your phone. I mean, in some instances, people's lives live on their phones. They do everything on their phones. And as I said, now we're looking at offering people therapy. So we have the AR and the VR. I teach online. So at the University of Johannesburg, we have a fully online distance learning qualification. And there, I never see my students. I have no idea what they look like. All our interaction is done through emails. Everything that they learn is already been pre-recorded. So there's no interaction between us. And a lot of the learning is going to go that way. It gives the students flexibility. It creates an environment in which people can work and learn at the same time. The content is still what we learn in a traditional academic environment, but it's enhanced with different tools that they can use in their day-to-day lives. So when we look at AR and VR, it's going to affect how we treat people with their illnesses, how we teach people, how we, well, if you think about painting your house, what is my house going to look like? What's the room going to look like with this color? That's augmented reality. You can change the colors. With robotics and automation in the medical field, we're now looking at using robots to try and do some of the tasks that we had people do. We're looking at automating some of the tasks that are less onerous and can be automated. So in a sense, there's the fear of job losses, but that also creates an opportunity to allow people to skill themselves up for other opportunities. And if we localize a lot of what we do, we can bring back jobs, we can bring back industries, and we can create more work. 3D printing is something that is quite interesting. A lot of the, one of the examples is 3D printing of motor vehicle parts. One of the motor vehicle companies actually realized that by 3D printing parts, they took their lead time down from 2 weeks to a few hours. And they reduced the costs that are attached to that. So now you can 3D print parts. So you don't actually have to wait for it to be manufactured elsewhere. Accident prevention and operation monitoring, you've got, in terms of artificial intelligence, you've got masses and masses of data. You can create an environment where you're monitoring constantly, and if you have issues, it can be dealt with immediately. Predictive maintenance, where you are actually looking at when perhaps an aircraft will need to come up for maintenance soon, or if you're looking at the railways, where you are going to look and monitor using the information you've derived from the past to create a timeline of when things will happen. And legacy system modernization, that's an important one. I think up until 2011, I used to have a clamshell phone. You know what that clamshell thing is. I don't think anybody knows anymore. And I called up the person, I was living in the UK at the time, and I called up the man to ask about how to fix something that worked, and he said to me, I can't even find the manual for this phone on the internet. So we're going, with the modernization of all the systems that we use, and now that systems and all of that have become so crucial, this has become even more important. What about looking at the pandemic in particular? How do we do that? How can using AI and automation help? I mean, this pandemic, in all fairness, happened 100 years ago. We had the Spanish flu. We had exactly the same thing. They treated it in exactly the same way. People had to wear masks. They had to social distance. People had to sanitize. And at that time, we didn't have what we have now. At that time, the virus was transmitted so easily because of the war. People traveled, but not because they were doing it for leisure. So how do we use AI and automation? How do we use what we have so that going forward, we can make sure that the risks that we are facing now, we can manage more easily? Well, it can be used for fighting misinformation, okay? One of the problems we have, and I imagine you've all seen it in the US elections, we even see it here, that information on social media can be transmitted instantaneously in real time. I don't know if you've all seen this advert on CNN where they talk about information about a cat or about cats and what can happen to them. And somebody has their cursor hovering over the send, and they follow the whole process through of sending this thing, and it creates this chaos. And the message there is very simple. Before you send something, think. Think about the impact that that's likely to have. We see it, as I said, in very real time in the US election. Information is being sent out that changes the entire narrative, even about the coronavirus. The masks don't work, 80% of people who wear masks get infected. Not true. So using what we have in terms of social media and things like that, you can fight the misinformation. Now you are forcing social media companies to flag these as fake news. So everything that we do is in real time. And the amazing thing is people don't understand. Once you press that forward button, you are no longer in control of how that information is used. Okay, finding new drugs. We have tons and tons of information. I mean, if you look at how quickly they have come up with this vaccine, from, say we started March, that's 9 months, less than 9 months to finding a vaccine that is 90% effective. Now they still have to test it for other side effects, but the wealth of information stored from having done this in the past is what they have to draw on. Again, increasing traceability and transparency by sharing information. We have all sorts of information available, okay? All stored, which we can now access and we can use. Using big data and AI, again, it links to fighting the misinformation, finding drugs with the traceability. We now have also contactless movement and deliveries through autonomous vehicles. There are robots that deliver food in some parts of America. Technology-supported temperature monitoring. They have drones. They use drones over crowds to actually monitor the temperature so that they can pick out people who potentially might be infected. And remote working. All the technologies we have at our disposal. We found that although working distance remotely is problematic from a social point of view, it gives us a lot of flexibility. And as long as you have access to technology, you can maintain your business and you can carry on. So finally, I guess all those companies who looked at themselves at the start of the year and thought, no, I can't let my employees work from home. Why do I need to think about remote working and my customers, and why do I need to think about all of this? Well, as I said, digital transformation is years away. I don't see our company having to change anytime soon. And the coronavirus comes along. Thank you.
Thank you very much, Imrani. We thought digital transformation was years away, right? Where are we now, right? I mean, I remember very well when I was still employed full-time that you needed to apply for special permission to work from home. It doesn't matter what the reason was. Sometimes even if you have slight flu symptoms, you'd be told, come in anyway, because the fear was you're not going to be productive at home. Look at us now, right? And that was not very long ago. I mean, I've only been self-employed for 5 years, so the world has changed completely. And it's said that sometimes we need a crisis for that to happen. I wish, we could be more forward-looking and know that, things will change, either because we are forced to change or we choose to change. I'm more comfortable in a space where I'm choosing to change as opposed to being forced to change. With that said, thank you very much for your presentation. Remember I said what we'll do is we'll load the speakers. So we're going to move on to our third speaker for the day. Indrani will be available, when I'm saying available, on the Zoom platform that I spoke about for a Q&A. So we'll now take about, let's take about 10 minutes because we've been sitting in front of our computers. I hope we've been sitting in front of our computers for about 2 hours or so. So let's take about 10 minutes, buy a break, grab a cup of coffee while we are preparing our next speaker. And then after that speaker, we will then move to the Zoom platform. But I'll keep you updated as we go along. Thank you very much. have our next speaker, whose name is Sipho Malifane. Sipho is going to be talking to us about evolving business continuity plans to include a pandemic response, right? I mean, there's no one that can, dispute the fact that maybe before the pandemic we had business continuity plans, but did they include, some kind of pandemic response or not? Some people are a little bit more advanced, so they would have already included or started thinking of including a pandemic response. So what he's going to be talking to us about is how you evolve your current business continuity plan to make sure that you include the response. So just a bit of background on Sipho. He's an independent business management consultant. He is skilled and a well-rounded professional with a solid track record of more than 20 years in both public and private sector, right? And his background is in finance and auditing, with accounting articles obtained with one of the big 5 firms. He served as a director of human resources. How you transform from a finance person to an HR person is a topic for another day. But he served as a director of human resources, and he's highly experienced in leading salary negotiations and employee relations management. He is also experienced in strategy development, performance management, and just management in general. Sipho is also a published author. And with that said, I'm not going to take much of your time. I'm going to hand over to him so that he can kickstart his presentation. Sipho, the floor is all yours, sir. All right.
Thank you very much for that spirited introduction, Busi. And good morning to everybody out there. The recent COVID-19 pandemic that is still with us has thrown us into a world that we had not known before. And in terms of evolving business continuity plans to include a pandemic response, it is a change that is inevitable. It is a change that is forced on us. We had to evolve our plans by default, but it is rather better that we be proactive about preparing for a pandemic. We are still in a pandemic the world over as we speak, but business continuity plans as we have them can no longer be silent on issues of a pandemic and how we respond as organizations, as companies in the public and in the private sector to a pandemic. Before I get into the issue of business continuity plans, I would like us to reflect a little bit, to reflect on what is a pandemic so that we have some level of context, some bit of context in terms of when we talk about evolving business continuity plans to include a response to a pandemic. What are we really talking about? And in yesterday's sessions and the previous speakers, I think they may have touched on this issue. But in terms of what is a pandemic, the Center for Disease Control and Prevention, the CDC, defines a pandemic as a disease outbreak that has spread across multiple countries and continents and usually impacts many people. The classification of a pandemic comes when a disease affects the global population. So it is not only confined to a locality, it is not only confined to a city, it is not only confined to a country, but it actually affects multiple countries and continents, as we know with the COVID-19 coronavirus, that it has now affected the whole globe, and hence a pandemic. Pandemics are usually caused by new infectious agents such as bacteria or viruses. And I thought it is important that I start the presentation with that definition so that when we speak about business continuity plans, it is plans that are built around a pandemic that is actually disease-based. And I think that is really important in terms of our plans. Examples of a pandemic. Recently, before we were hit by the novel coronavirus, COVID-19 virus as we know it, or pandemic as we know it, we experienced in 2009 the swine flu pandemic, which was otherwise known as the H1N1 pandemic, that has killed close on to 285,000 people across the globe. 285,000 people died from H1N1. And before H1N1 pandemic, we had the HIV virus, or AIDS if you like, HIV/AIDS pandemic. This one has affected over 70 million people, affected 70 million people across the globe. And just more than 100 years previous to the current COVID-19 pandemic, in 1918, between 1918 and 1921, the world experienced the Spanish flu. The Spanish flu is estimated to have killed more than or close on to 50 million people. 50 million people. It is quite a staggering number, but that is a reality. And we have seen now with the COVID-19 virus, we have had people dying across the globe. People have lost lives, and it is still continuing. It has not stopped. And so we cannot be oblivious to what is happening. It is a reality. And in terms of business continuity, we know that there was at some point at the beginning of the crisis with the COVID-19 pandemic, when the lockdown was announced in March, 26th of March, by government or by the president, there was a debate around whether we should be saving lives or if we close the economy due to the lockdown, what about livelihoods? So I think with the experience that we have, it's not an either-or situation. It's not so much about whether you save lives or whether you save livelihoods. You cannot save lives if you are not going to open the economy. So it is about creating that intricate balance. And I think if we have to reflect objectively what government has done so far, they have done in terms of our own country here, South Africa, they have not done badly. They have done sterling work because the government was proactive to have a lockdown and to communicate clearly what is happening or what ought to be happening, and the different stages that we have gone through, from the highest stage, level 5, to the current stage, level 1, which yesterday night the president announced what is now referred to as a watered down version of level 1. So we have seen more opening up of the economy so that we can sustain livelihoods whilst still being concerned about safety measures in terms of how we interact as individuals, how we interact as organizations, how we interact as now more and more people have gone back to the workplace. The issues of social distancing or physical distancing, the wearing of masks is something that has been emphasized by the president and by government, and it is something that we need to be conversant with and that we need to comply with, whether in the workplace or whether in our private spaces. But yeah, that is just in terms of the introduction with regards the pandemic itself and the history of pandemics, as this is not something new. It is something that has happened in the past, as I've indicated, with the Spanish flu of 100 years ago, and previously with the HIV/AIDS virus and the H1N1 virus, as it was called. But just in terms of reflecting on business continuity management as we traditionally know it, business continuity management has become an essential management practice in today's world, which indicates that management is aware of the necessity for good corporate governance, and not only about good corporate governance, but to ensure that business continues when we are in a crisis. When there is a disaster, how do we respond? We need to have this business continuity management so that we are able to respond, and we are responding decisively. Amongst other elements, a successful business continuity management program includes the development and testing of well-defined and structured business continuity strategies and associated plans. So we need to have clear programs that are strategy-based, and that there should be clear plans that direct how we manage business continuity. Strategic change properly thought out through. So when there is a crisis that requires that we need to respond, we need to have a change that is properly thought through. That is documented so that it doesn't just reside in somebody's head, but that everybody can go to a document and be able to understand what is required of them. That is implemented and tested. So when you implement, you actually test the robustness of your plans. Are they comprehensive enough? And are they flexible enough to respond to the situation at hand? Business continuity strategies and plans will facilitate the company's response to and recovery from unforeseen disasters or emergencies as effectively as possible. But this is talking to business continuity management in a conventional sense of the plans as we know them, not necessarily responding to a pandemic as this is what you are now grappling with. The purpose of a business continuity plan, if we have to recap it, because I am sure it has been touched on yesterday, but I thought it's still important that we touch on it. It is to provide guidance in terms of the processes and procedures needed to continue the business entity's urgent or critical management operations. And this is following an unplanned business disruption. The plan must specifically cater for worst-case scenarios affecting the following enablers. Your building or your premises. As a company, you operate from a particular space, and that space is your building or your premises. In those premises, you have equipment that you utilize for the running of your operations. So your business continuity plans must look not only at the building itself or the space, but the equipment that you're going to use. Is the equipment still usable? How has it been affected by the disaster that is at hand? The technology platforms or applications, and even the security of your data. Do you still have your data secure? Are your technology platforms still usable after a disaster has struck? And what about the critical element, which is your human resources and the administration of those human resources? You need to make sure that human beings that actually operate in your company or in your organizations are secure. So how is your business continuity management or your business continuity management plans responding to issues of human resources. And third parties could be your customers, third parties could be your suppliers, your supply chain management partners, but also your stakeholders. So the plans or your management must respond in all fronts. The suppliers, the customers, as well as your stakeholders. Again, I want to emphasize this is conventional plans in the sense of business continuity management or plans as we know them, but not necessarily when we speak about responding to a pandemic. So when you talk about evolving business continuity plans to accommodate or to respond to a pandemic, they must address all those issues: your building, your equipment, your human resources, your technology platforms, and your third parties. But we will come to that. Fit for purpose plans. So I have said earlier on that your plans need to be comprehensive as well as flexible enough to respond to the type of disaster or whatever the situation that you are facing, so that you can continue with your business, that you are able to run your operations, so that even though there are disruptions, the disruptions are as minimal as possible. So a fit for purpose plan must comply with business continuity management policy. So you need to have a business management policy that governs. That is the basis for your plans. And it must include the following: the assignment of roles and responsibility for business continuity management and execution thereof by relevant role players. So there must be clear delineation of roles. Who is responsible for what? But we'll come to that. Plan distribution and education and training. It doesn't help if you have a plan out there that is documented, that is comprehensive in terms of what is documented, but nobody knows about it because people have not been educated or trained around the business continuity plans. So it is important that this is something that is streamlined within the organization, across and cascaded across the organization, so that everybody knows about the plans and who is responsible for what and who is supposed to do what in case of a disaster or possible disruptions to business arising out of a crisis. And now, importantly, arising out of a pandemic situation. There's been serious lessons learned now with the current COVID-19 pandemic. We have had to go back to the 1918 to 1921 Spanish flu pandemic to see how people have responded, how governments have responded, how individuals have responded, how organizations have responded. But when you have a plan, it is important that in-house, that plan is rolled out, distributed, cascaded across all levels in the organization. It is not a plan that sits there for the business continuity management team, that sits there only known by senior management in the organization or executives in the organization, but it has to be rolled out by way of training so that everybody knows their role, everybody knows what to do. We have seen that it has become imperative that we evolve the plans to include a pandemic. Business continuity business continuity plans, testing, applying varied testing approaches. You have a plan, you need to test that that plan works. So we need from time to time see that we're able to respond. So if for instance, one can make example of a fire drill. A fire drill is not announced, but it's something that happens on a particular time frame so that we can test our readiness to respond to a reality that may hit us. So what is our readiness to respond in terms of the future with the pandemic? Noting also that the pandemic is still here with us. So we need to evolve our plans to also cater for a pandemic situation, given that it is with us and looking forward to the future as well. Periodic review, maintenance and update of the business continuity plans and related documentation. So we need to review the plans. Clearly, the current COVID-19 experience tells us that most of our plans, and I'm saying most of our plans because I believe that listening to the previous speaker, that there are things that they had done in their organization on a proactive basis, but clearly there are lessons that can always be learned from the current experience, so that it is incumbent on business continuity practitioners to ensure that there is an evolving of the current plans, because clearly the current plans, most of them had not incorporated management in times of a pandemic, and hence this issue that we are tackling today. Auditing and assurance reporting. So we have plans, we have tested them, and we conduct audits on a regular basis. And what reports are we going to be issuing? What recommendations are we going to be making? What changes are we going to be making in the organization? How is it impacting on business strategy? How is it impacting on operations on an ongoing basis? Typically, when one looks at business continuity management, there are three phases in a typical business continuity management setting. It's when we respond in an emergency situation. This is the immediate response to an incident or a disaster where actions need to be taken swiftly in order to safeguard life, limit injuries, and prevent escalation of physical damage. This phase includes, but is not limited to, building evacuation procedures. This is again talking an emergency response in the conventional sense. But the COVID-19 pandemic has had different impacts to different organizations. In some instances, there has been issues of an emergency where people become sick and they have to be taken to hospitals, and hospitals are flooded with or overwhelmed with the numbers of people that are coming through needing treatment. We have seen that there has been shortages of ventilators the world over, and that now is in an emergency situation. So it may not always apply across the board to all organizations, but if you are in a hospital setting and you are flooded, there is an emergency that needs to be responded to. So this is where we need to make the distinction between our conventional plans and plans that are now responding or responsive in a pandemic situation. Crisis management. Will one consider the pandemic that we have as a crisis? Yes, certainly, because we did not know how we were going to respond. Certainly, if one has to do a comparison across the world, certain governments that were proactive have done well, have fared better than others that were not as proactive. And I think we should be proud as South Africans that our government was proactive, as I have indicated. So how does government respond in a crisis situation? How do individuals respond in a crisis situation? How do organizations respond in a crisis situation? So in a conventional sense, this is a role that is assigned to senior management. It's a senior management function, aimed at strategic decision making and provision of leadership to the organization. Somebody must take a lead. Somebody must tell us what needs to be done when we are facing a crisis in an organization. There must be direction for an incident, for disaster management. This phase also focuses on ensuring effective internal and external communication during and after the incident. Unfortunately, in times, this is now talking business continuity management and business continuity management plans in a conventional sense, where you're speaking to an incident of a disaster. But here, we're not talking about an incident. We're talking about a prolonged period of a pandemic which is not coming out of a building crashing or a flooding or an earthquake. Your buildings may be intact, but we're talking about a disease. We're talking about a virus. And not only are we talking about a disease that is as a result of human contact only, but we're also talking about a virus that is airborne. There has been a lot of contestation about whether the disease or the virus is airborne or not. And as we experienced over a period, new information came. New information came from the CDC, new information came through the WHO, the World Health Organization, that has had us to respond differently as countries, that has forced us to respond differently as organizations, that has forced us to respond differently as individuals. And so in as much as we say somebody must take charge, we have seen how the South African government has taken charge. We have had the president leading from the front, but also supported by his Minister of Health. We have also seen how cabinet has defined various roles to different ministers responsible for different portfolios at the country level. The same must apply in an organization specific sense. So senior managers must lead from the front, but there is a need in terms of our business continuity management to have a business continuity management team comprising of senior managers with different roles, and we'll come back to that. And that is the distinction that we need to make in terms of the conventional plans versus new plans that incorporate management in a pandemic. So it is an imperative that is forced on us, that you can't ignore the fact that we're living in a pandemic. We can't ignore the fact that we still don't know how long the pandemic will stay with us. So we need to evolve our plans. Business continuity, the third scenario or the third phase, is talking to business continuity or business recovery. So in a conventional sense, you have a disaster, and after a disaster, you have had an earthquake, you have had a flooding, you have had a fire to your building, and business has been disrupted. Then you have to respond for recovery purposes in a conventional sense. This is the process of recovery or continuing urgent and critical business processes in the shortest possible times after the disaster in order to minimize the impact to the organization. This process should not be confused with business resumption, which is aimed at returning business to normality or normal operations. It is a recovery in the shortest possible time so that you have continuity of business. But it does not necessarily take you to full operation at that stage. But again, I want to emphasize, this is talking recovery in a conventional sense. So how do we talk recovery in a pandemic situation where we have the virus, the COVID-19 coronavirus, still with us? So as we strive to get a business to business recovery or business resumption. For example, we need to include the construction or sourcing of new offices, replacement of all damaged equipment, and long-term recruitment of employees. Again, I'm saying this is what you will do in a conventional sense. When you are dealing with a disaster arising out of an earthquake, for instance, a disaster arising out of a flooding, a disaster arising out of a fire as a possibility, how do you resume or recover business operations in the shortest possible time frame? And this is what we do with business continuity management in a conventional sense. But with a pandemic, such as COVID-19, as we have seen, it requires a different response. You have not necessarily lost your offices because they are intact. You have not necessarily lost your equipment, your IT equipment, but you may not be in a position to utilize your building, your IT platforms in your offices in a conventional sense because of restrictions that may happen. When there was level 5 lockdown, everybody had to be home. The restrictions were as tight as that. Everybody had to be at home. Only certain industries were allowed to continue operations under very strict regulations or controls. We know that essential services, now government define who falls within the ambit of essential services. So we know that medical personnel, your police, your traffic personnel, as well as people that work within food manufacturing industries were allowed to continue operations with strict controls still in place when the rest of the country had to sit at home or to be forced to work from home. So you have your buildings intact, you have your personnel, but you cannot operate from your offices. So how do we talk business continuity management and business continuity plans in that sense? Because you are now not going to be responding to a flooding. You are now not going to be responding to a building that has collapsed. You are now not going to be talking about renting alternative office space in a locality that is convenient for your operations. You have your business offices, but you can't utilize them. Or you can utilize them in a very, very restricted sense. And that is what a pandemic has shown us. So hence our business continuity management and our business continuity plans have been forced to evolve. And I'll come to that aspect of how we evolve them. In a conventional sense, if we look at our business continuity plans, they must be talking to who is responsible for what. I've indicated the issues of having a business continuity steering committee with a business continuity leader, and responsibilities in the plans clearly defined, action plans and the various phases and stages that need to be followed, what decisions need to be taken, when what has happened, who must do what. That is in the conventional sense. Business continuity plan leader who must give guidance, direction, who must assess the severity of the situation, who must receive incident notification, who must conduct initial assessments, read the extent of the event, and this is an event-based, but here, when we're talking involving the plans, we're talking about a different type of an intervention that still needs to happen. Is the incident serious? Certainly in a pandemic, it is serious. If you lose a building, it is serious. You cannot operate as a business. Where a decision has to be made at that level, whether there is a shutdown Unfortunately, in a pandemic situation, it is not upon business, individuals, it is not upon individual organizations, but it was a decision that came out of legislation or regulations as proclaimed by government, as pronounced by the president. Everybody on the 26th, we went into lockdown, level 5, and we were told this industry can continue to work. Do you fall within that category of essential services? If not, then people had, or organizations had to think quickly on their feet about how you recover operations in the shortest possible time. And in a conventional sense of the business continuity management, you then establish a command center, notify business continuity team members to convene at the command center. In a pandemic situation, you may not necessarily be able to do that, but you may have to find remote ways of doing it, depending on whether you're defined as an essential service or not. And that is the distinction between conventional plans and why we need to evolve these plans in a pandemic situation. Conduct disaster declaration meetings. In a conventional sense, you can have physical meetings, but in a pandemic, you are forced to conduct meetings via Zoom. Now everybody, even those people that were not inclined or not very familiar with technology, have been forced to familiarize themselves with use of technology. Zoom as an example of something that has now become part and parcel of how we conduct business meetings. Yeah, those are the plans in the conventional sense. And when we're talking about good practice guidelines, new good practice guidelines, it's about creating an ecosystem so that everybody is part and parcel of that ecosystem. So that it is not about having business continuity management and the plans that reside in the responsibility of a senior manager or senior executives, but it is, as I've indicated, plans that need to be cascaded. So you need to create an ecosystem that is talking to your back end issues as well as your front end personnel. Your back end talking to your supply chain processes, your operations, and your front end also looking outward to your customers. So it needs to be comprehensive, and it needs to be clear in terms of who is it talking to. Top management has to be involved, and you must be able to conduct a business impact analysis utilizing those plans. What is the impact to business? You know, at a glance, when you are in a conventional disaster. But what is the impact to business? It was not obvious when the 26th lockdown was announced. Everybody had to go sit at home. It created anxieties. We were not sure how is this going to unfold. Time frames were defined, but for how long were we going to be sitting at home? So we had to look at, this is an immediate disruption to business, not in a conventional sense of how our business continuity management plans, as we know them, are responding in a crisis or in a disaster situation. This was a completely different ball game, and it would seem even governments had forgotten the lessons of the 1918 Spanish flu pandemic. Those lessons had been lost or had been forgotten. So it is something that had forced us to adapt as we were going, and relying largely on the directives as provided by government, and not so much about the directives coming from our own business continuity management plans, because they had not, to a large extent, as I've said, catered for a pandemic situation. So taking business continuity to the next level, now incorporating a pandemic response. And I've mentioned the different role players, your supply chain partners, your operations, and how you also outward facing to your customers so that you can have your business continuing. So this slide speaks to the ecosystem. What is the purpose if you're going to be establishing a business continuity management team? What processes are going to be followed? What is the impact in terms of your technology? What is the impact? Who is responsible for what? Defining the roles. And what is the impact on the operations? What are your critical business operations that you cannot do without as an organization or as a business? But I'll come back to that. So if we're talking about assessment and review of a business continuity plans for a pandemic, the first thing that you need to do is to establish, do you even have business continuity plans to begin with? And here I'm talking, do you have a business continuity management plan for a conventional situation, for a disaster, for an event that can put you out of business? And I've mentioned the examples: a fire, a flooding, a war situation, okay, or an earthquake erupting. Do you have those plans to start off with as something that you can build on top of? So you need to have that critical assessment at the onset. Is the plan, assuming that it exists, is the plan robust and flexible enough to deal with a pandemic situation such as COVID-19 as we find ourselves in this COVID-19 novel coronavirus? Do we have plans that have accommodated that? Certainly, if we have to be honest, not all plans have accommodated a pandemic. The plans need to be assessed and reviewed to identify gaps in dealing with a pandemic. So if there is nothing that speaks to responding to a pandemic, you have a gap, and how do you close that gap? If you had a semblance of something that you can use to respond, and I'm sure most plans have a semblance of procedures that can respond, even though they were not specifically defined or designed for a pandemic, but there is a semblance of procedures. You have a disaster management committee, okay? Now we have learned through the COVID-19 experience that we needed to appoint a COVID-19 champion within the organization, preferably somebody with authority, preferably somebody in senior management that can lead the committee and the processes, as well as communication within your organization around how to respond to the pandemic. Now, I'm going to be tackling about 7 strategies that one can follow in terms of, or incorporate in evolving your plans to incorporate a pandemic response. And I've said lessons learned from COVID-19. We are still within the pandemic, even though in terms of our country specifically, we have gone from level 5, we're now at level 1, and depending on behavior and depending on the assessment by government as to whether we're making significant improvements, one can say we have it under control. But can we really say, in the South African context, we have the pandemic under control? There has been incidents of a rise in the number of new infections, new daily infections, especially in the Western Cape. We have seen how Western countries have actually not done as well as was predicted. They have not done as well as they had predicted, comparatively speaking, in comparison to Africa, comparatively speaking, in comparison to South Africa. I think as South Africa, we are leading by example. We have seen how in the UK, they have now gone back to strict lockdowns. In the UK, they are going back to stricter lockdown. They are closing a lot of areas that they had, I think, opened prematurely. We have seen or have heard reports as recently as yesterday of huge numbers of new or renewed infections in the United States. The leading country in the world has not done so well in terms of management of this pandemic situation. So hence I'm saying a pandemic response and lessons learned from COVID-19. That is still with us. Things look like they have stabilized in terms of our situation in South Africa, but it can go wrong, and it can go wrong very quickly, depending on behaviors as individuals, as well as depending on behaviors within organizations. Are we respectful of social distancing? Are we washing our hands? The very simple hygiene issues, as simple as, I listened to the previous speaker speaking about human beings as creatures of habit. Indeed, we are creatures of habit. Psychologically speaking, when one speaks about a climb down from level 5 to level 4, we relax our approach and our behavior. A further climb down from level 4 to level 3, we relax our behavior even further. A climb down to level 1, the behaviors have changed. There's no more conscious social distancing if you look at how we behave in the home front as well as in the organization. But as organizations, we have even bigger responsibility, and these plans are not just documents to be filed, to be sitting in the senior manager's office, locked away in a cabinet somewhere, but they're documents that must be living documents that must be lived within our organizations. But in terms of talking to the 7 strategies, the first thing, if I may go back, I spoke about a conventional plan to speaking to loss of a building. And it may seem like we've given buildings priority number 1. We have spoken about loss of equipment. It seems that equipment becomes second in line. We speak about technology platforms as if they are maybe the third in line. And then we've put human resources, even though I have no numbering 1, 2, 3, and 4. But it would seem, psychologically speaking, that human beings become number 4 and third parties out there are a last consideration. But certainly in a pandemic, we cannot do that. Our human resources come first. Human life, securing human life should be our first priority. The issue that I mentioned, the debate between saving lives and livelihoods. Our mindset should be, the first thing is to prioritize our employees in a work situation, in an organizational setup. The first thing should be to secure human lives. So we must immediately ensure that employees are safe, and we must not only ensure that employees are safe, we must ensure that their family members, immediate family members, are also safe. There is no one in a pandemic situation, there is no one who is likely to go and work knowing that their family members are not secure. It's just not going to be happening. It's human nature. You default to saving yourself and you save your family members. So we need to ensure that the safety of our employees is guaranteed or secured to the extent possible from what is within our capability as organizations or as companies, but to also gather information about the safety of family members of our immediate family members of our employees. And hence I said, in comparison to the conventional plans, we need to implement a pandemic management steering committee. Now here is the difference. I've shown you the slide in terms of a conventional plan which has got a team leader and business continuity team members. The team leader establishing a command center and team members converging in a command center to deal and assess a situation as a disaster or that creates a business disruption as it unfolds. But with a pandemic, we need to look at having a business continuity management plan that also has elements or aspects of a pandemic management response. And that is important. It is important because there are certain things that ordinarily will not be included in your conventional plans, as I've indicated the elements in the plan. Okay, talking to a crisis, an emergency situation, and recovery to operations. Here, you may also want to also incorporate government regulations. Government regulations that we have no control over because it is what we need to comply with. Then you need to establish key operational team members. Who are the key operational team members that will allow you to have at least minimal operations going? Whether you do it in your offices, if you have you were declared an essential service, or as government was relaxing the levels and then other areas of businesses were allowed to go back and work, okay, you still did not have everybody going back to the office, okay? But who were the key people that are going to ensure that you continue operations? And then the issue that everybody has been talking about, exploring remote working solutions, okay? Then there you need to look at your core business operations versus your support functions. Your core operations where you need to have people physically going into the workspace, or are your people able to work remotely depending on the type of work that they do. You need to make that assessment. And if that is the assessment, as most companies have had to do, are the company IT systems robust enough? And if we're looking at the robustness of your company's IT systems, it's also about, have you got VPN connectivity? Okay, virtual private networks, okay, where people can work remotely, but are they secure? What is the security levels of those VPN remote connectivity platforms? Your firewalls, have you built robust firewalls so that your IT system cannot be hacked? Because people are aware that everybody is working from home. There may be attempts at hacking or penetrating your IT platforms. Hence, the need to build in firewalls. But one must be aware, as you do this, there are cost implications. Identify risk and impact of the pandemic, possible impact scenarios. I'm trying to move a little bit faster. What are the travel restrictions that have been promulgated by government through the various regulations for levels 5, 4, 3, 2, and 1? We know that there has been curfews and different types of curfews. Okay, increased chances of infection from employees using public transport. No, not everybody has got the luxury of using private transport. Most of our employees still use public transport in the form of taxis. then if they're using taxis, what are you able to do as an organization to meet them halfway? Are you able to organize private combis as opposed to exposing your personnel through the use of public transport? And if they're working, for instance, in a manufacturing setup, are you able to take them home if they clock late at night and not being foul of curfew regulations, restricted employee mobility in case of national lockdown, okay, which will impact on your business if you're working shift hours, for instance. Slowdown in business activity impacting negatively on your sales. Part of my life, I'm involved in food processing. When the lockdown hit in March, we were immediately hit directly by, we had a direct impact, an immediate and direct impact, because some of our customers are people that supply the restaurants, and some of our customers were the restaurants themselves. So when restaurants were restricted from operating, our company was immediately, directly affected. So there was an immediate slowdown. And what is the impact? Do you lay off some of your staff members? We have seen that companies have had to close. Companies had to lay off some of their staff members, and in some instances had to work short hours or shorter weekdays. I'm talking about those companies, like in our case, in the food industry, that was allowed to operate, but because restaurants were not allowed to operate, we had to scale down on our operations, which means there is a direct impact on your bottom lines. Increased cost of setting up remote offices. I've mentioned if you're going to have most of your employees working remotely, setting up VPN connections, even having to conduct meetings via Zoom, there is a need for capacity in terms of laptops. Internet connectivity, which means if people are working remotely, you provide them with data. As an organization, it's a direct cost to the company. One may say, yes, the employee is not traveling, there is a reduction in terms of time that they spend, the 2 hours that was mentioned in the previous presentation, you no longer have that. But on the other side, you have increased costs because of data connectivity requirements. And there is this natural fear that we're thinking that people working from home, immediately we may experience loss of productivity. It has not always been true. Some companies have actually experienced improved productivity. Okay, there is a need to improve your communication. Clear communication, dealing with employees, clear communication to suppliers. Okay, there must be a clear protocols and clear strategies. Communication should be concise. Okay, business plans must monitor cost escalations. I've mentioned that. Consider alternative supply pipelines. In the case of a COVID or a pandemic situation, will you still be able to rely on the same suppliers? Will they be able to supply you, or will they be closed down, or their companies closed down? What alternative mechanisms do you have in terms of ensuring your continued pipeline of supplies? What is the impact on your budget? Does it mean now you are forced to revise your business plans? Indeed, in our company, we had to revise our business plans. We had to cut down on some of the partners that we used. Some of my responsibilities in the corporate services, I had to leave those and concentrate on the sales so that we minimize the cost and not rely on agents or third parties. So you need to be mindful of your cash flow. There is a direct impact if there's a slowdown in your business. There is a direct impact on your cash flow. How do you continue? Do you lay off the staff if they're working at home? You say, sorry, I have to lay you off. Or you continue paying them. Where are you getting that money if you don't have sales generated? So you need to look at the reserves that you have, negotiate new bank overdrafts, and talk to your partners to tap into the kitty to fund the business. What are the key business priorities? I've mentioned revising your business targets to say, you know, you wanted to have so much of sales, but now you know you can't. Renegotiate payment holidays with your banks on your overdrafts. We have seen the 3-month payment holidays that was given to companies and to individuals. And if you're renting premises, you need to renegotiate your rentals, because otherwise the business will not survive. Exploit government support programs such as what we have seen with UIF and the TERS that government has been providing. Unfortunately, we know what has happened in that front, but we saw that government is committed to continue with TERS for another month. So those are programs that one can tap into. Revise business strategy. Some companies that could not operate, for instance, because of loss of revenue, have had to reinvent themselves in terms of strategy so that they survive. Look at what is the root cause, what are the timelines that you may survive without that pipeline of continued business. Is your infrastructure geared to support you if you're working remotely? What happens when you lose some of your employees because not everybody is able to come to work due to a direct impact from a pandemic if somebody gets sick? Have you trained people? So your business continuity management must look at training people. In our case, we had a lot more people trained from the the immediate area, such that when we could not have somebody working, they were on a call. So yeah, that's some of the things that we've done. Change management cannot be overemphasized. I'm not going to talk too much. Change management is about getting business ready to a change situation. Change management is nice when it is a change that we determine ourselves. But a change that is forced on us because of a pandemic, everybody has to change. Everybody has to adapt to new ways of conducting business if we are So a change that is forced on us is not a nice change. It can put one into a depression. But you know, we're talking the fears, the various stages of a denial. This is happening to me. My family members are affected. I'm affected. What does it mean? My confidence, am I fearful of even venturing out of the house to get into a taxi, to go out there, even if I'm wearing a mask? I may be fearful. Some people may be paralyzed by fear. So, and then gradually, because we know it's long term, we accept it, and then we start inviting people into our homes for parties. And we stop wearing masks, and we start even hugging. No more the elbow, it moves to something else. We shake hands again. Creatures of habit, that's who we are. But a pandemic can stay as long as 2 to 3 years, and it may go, it may come back. So how are we responding with our plans? That is how we evolve business continuity plans to incorporate a pandemic situation, lessons learned from COVID-19. Thank you very much.
Thank you very much, Sipho.
Thank you.
Thank you. I'm glad that you left it on the slide, because this is my favorite topic, right? Because most of the times we tend not to think about it, yet it is probably over and above your plans. It is probably one of the critical enablers, because you can have the greatest plans, you can have the biggest, bank balance, but if your people who need to do the work are not allowed, well, not that they are not aligned, but they are not keen to adopt any change that you are bringing on board, rest assured, you will remain exactly where you are. So says the change management practitioner. With that said, thank you very much. We are now going to close off this session, which means you are watching us now, of course, via YouTube. We're going to transition from this platform to the Zoom link. As I'm speaking to you, that link is on standby, ready for you to log on. Our speaker is already is also on standby, ready to deliver quite an important topic. So what I would like to suggest is that you log off because this session has ended. But remember, at the end of the presentation that will be delivered via Zoom, please do not leave. There is an opportunity not only for a Q&A session, questions posed to the most immediate speaker, but we'll invite all the speakers that we've had today. So they'll also be there. So which means we have some kind of a virtual panel. So you are allowed to ask questions to anybody or to a specific speaker, depending on when the question came to mind. With that said, I want to thank you. So we're closing off this session. We're going to transition to Zoom, and I'll catch you on the other side of Zoom. Thank you.